from previous experience together to make this. So we shouldn't be discouraged. Let's just continue working as a team, bringing ideas, new ideas, being excellent at what we do. Being a lady, you can become an engineer. You shouldn't just be limited to those careers that you see, that, think out of the box, be innovative, There are women that are engineers, and there are companies like Aspen that do hire us. My name is Deitra Mhlanga, production team leader at Aspen SVP2. I studied chemical engineering, so I have a national diploma from the University of Johannesburg and a BTech degree from UNISA. It's amazing to be part of a global change, to know that you're bringing change to Africa, you're bringing change to people, people that will need this vaccine, and that what we're doing here is changing the world. Yes, I would just like to say, guys, that we are a team, and it takes a team to build something. We come from different backgrounds. We have different qualifications. Yet we all come in together, bringing what we know from school, what we learned from school, from previous experience together to make this. So we shouldn't be discouraged. Let's just continue working as a team, bringing ideas, new ideas, being excellent at what we do. Being a lady, you can become an engineer. You shouldn't just be limited to those careers.
There are other matters that Premier will provide information on to the people of the Eastern Cape, and after that, after the statement that Premier will present, we will allow you an opportunity to ask the Premier and the MEC questions about the update that we're providing. We're coming from the visit to one of the landmark factories in the province, in the Nelson Mandela Bay Metro, where a drug that is a landmark drug is being manufactured. So we are focusing on the work at hand, and I'm not going to waste much time and invite the Premier to the stage to take you through and engage you from that point. Thank you very much.
Well, there's a ECPG in the lang. I might put Dali from there. So, ECPG is not taking my important. Yes, God. Thank you very much, Mr. Stretcher, the facilitator of this briefing. Greetings to the MEC Math, MEC for Health, and good afternoon to the members of the media houses that are here. You're all welcome to our COVID-19 response media briefing. The update we share with you is meant to avail crucial information to be disseminated to our people, which they should use to protect themselves and their loved ones from the COVID-19 pandemic. Furthermore, they should use the information we provide to play an active role in our efforts to put an end to this pandemic. Therefore, the focus of our media briefing today is on 4 areas, and these are the status of the COVID-19 pandemic, plans to curb the spread of the virus during the upcoming Easter holidays, update on the vaccination rollout program, and lastly, our intervention to assist students access higher education in our province. In our State of the Province address, we said one of our priority areas for this year is to deliver a knockout blow to the virus and to end its reign of terror in our people, which already has claimed almost 11,355 lives of our citizens to date and caused a devastating impact on our economy. Over the past couple of months, we have seen a glimmer of hope that an end of the terror of the pandemic can be realized. We've witnessed a sustained decline of new COVID-19 cases in February and March. What has worked wonders for us in particular has been the mandatory wearing of masks in public areas, the enforcement of social distancing measures, and the limitation on the number of people who attend gatherings. We are encouraged by the significant decline in COVID-19 related deaths and hospitalization numbers. This has considerably reduced stress in our health system. In the last 24 hours, no death was reported in our province. In the current month, there are fewer SARS-CoV-2 cases and related deaths, but a higher case fatality rate of 8.5%. There are currently 98 patients admitted for COVID-19 illnesses in our province. 48 patients are in the public healthcare facilities and 50 are in the private healthcare facilities. This huge reduction in the number of admitted COVID-19 patients is allowing the Department of Health space to focus on revitalizing interventions to contain and manage other priority diseases. We continue to conduct COVID-19 tests. In the last 31 days, we have conducted about 16,000 COVID-19 tests. The National Laboratory Health Service reported 82% of the test results within 24 hours, and over 90% tests were received within 48 hours. This demonstrates an excellent capacity in our national laboratory services. On average, we had less 15 cases a day, and the national laboratory reported that highest number of these cases were in our two metros, the Buffalo City and Nelson Mandela Bay. We have also had a substantial decline in the positivity rate from 2.5% to 1.4%, and this demonstrates a positive trend of low community transmission as a result of adherence to alert level 1 risk-adjusted measures and also the compliance by our people. This week is Easter weekend, and this will increase human movement which means increased movement of the virus. Researchers in our very own Nelson Mandela University has warned that the trouble is coming with a third wave. What is worrying us in their analysis is that they say the third wave might be driven by the Western Cape and spread to the rest of the country. The Easter weekend, therefore, poses great risk to our province as people will be moving from the Western Cape to spend time with their families in our province. Let me remind the members of the media about what happened around the Easter weekend last year. The Easter weekend last year was on the 10th of April, and by the 20th of April, we had about 638 active cases and 35 deaths. By the 20th of May 2020, that is a month later of that Easter weekend, we had already recorded about 3,282 active cases and sadly lost about 285 people. During that time, we were on hard lockdown, but the virus spread like wildfire, and most of the active cases we tried to manage were to a larger extent as a result of the movement of the people during Easter weekend. Unfortunately, we cannot close the provincial boundaries to prevent our people from coming home. We have participated in the National Coronavirus Command Council processes, and even earlier today there was a meeting chaired by the President. We have made our inputs there. What we don't want to see is a free-for-all Easter weekend, which will leave families crying for lost loved ones and after the Easter. The President will address the nation at an appropriate time to outline the decision of the National Coronavirus Command Council. Kodwa ndiyafuna ukwenza isicelo ngokuzithoba okukhulu nangentlonipho imbeko kubemi abaneminyaka engama-60 ukunyuka bazalulu oontanga benu sukela oko iqalile kulo nyaka uphelileyo. Siyacela ninyamezele ukuhlala ezindlini zenu kuba loo nto iza kusindisa ekufeni. Izinto enifuna ukuya kuzo ezinjengeenkonzo zifumana xa iphelile intsholongwane. Ndicela niphoswe kulo nyaka abazali bam, nihlale emizini yenu. Sisanidinga kakhulu kulo mhlaba nokusinceda ukusinika amava nobulumko okubheka phambili. On preparation for the eventuality of a third wave, our health care system is ready to withstand the third wave.